I think I need to introduce a bit what is this or why we did this trial. So this trial was conducted in a Portuguese hospital, and it was conducted by me and a team from the OncoMove program. And so I think I need to introduce the OncoMove program before explaining the trial. So this is a program that belongs to the Portuguese Society of Supportive Care in Cancer. And in fact, this program aims at including physical exercise among the supportive care offered to cancer patients and cancer survivors by doing research and implementing it in the community at the same time. So this trial was the first trial of the OncoMove program. And to introduce a bit the topic briefly, as breast cancer survivors usually face a decline in quality of life, particularly during adjuvant endocrine treatment, and also as physical exercise has shown to be effective in increasing quality of life in cancer survivors in general, although in highly heterogeneous studies. Physical exercise is seen as an effective supportive treatment. However, barriers to the implementation of physical exercise are very well identified and described in the literature. And that's why we designed this trial. This is a single center, a double phase trial destined to breast cancer patients who have finished the primary treatment, meaning surgery, radiation therapy, or chemotherapy, whatever was the last treatment, at least 1 month before the inclusion. So in the trial, all the patients underwent a 16-week control phase, followed by a 16-week intervention phase, and they were assessed 5 times from the moment of the baseline until the end of the intervention every 8 weeks. So what was the intervention? The intervention was a supervised combined physical exercise program. By combined, we mean a combination of aerobic and resistance training in group classes with access to limited equipment in a local gym 3 times a week. So the primary endpoint of this trial was the global health status domain of the EORTC QLQC 30 questionnaire. And we would need to include 54 patients in the final analysis to be able to show a moderate benefit during the intervention phase between the beginning and the end of the intervention phase. So this is an important number, the 54 patients. Secondary endpoints included were other domains of the same questionnaires, also the domains of the BR23, the cardiorespiratory fitness, the physical fitness, and body composition. And we also performed an exploratory analysis on immune, inflammatory, and cardiometabolic biomarkers only on 16 patients, the ones who accepted to be included in this exploratory analysis, and to collect blood samples at 2 time points in the control phase, and the other one 8 weeks after the starting of the intervention phase. So now the results. Out of the 82 included patients, unfortunately, only 37 patients were included in the analysis. And why was that? The main reason for the dropouts was the COVID-19 pandemic. So with the mean age around 60 years old, one thing we think it's very important is that more than 86% of the patients were overweight or obese. And the global health status domain score significantly decreased, a median of 10 points during the control phase, and while it steadied during the intervention phase. Other domains of quality of life increased during the intervention phase, namely the physical functioning and the sexual functioning. The same happened expressively with the BMI, the body mass index, and the waist circumference, that were the variables used to assess the body composition. And as I've told you, the majority of the patients, they were really overweight or obese. And finally, regarding the biomarkers exploratory analysis, we could observe a trend to decrease some inflammatory markers and a significant decrease of the saturated fatty acid C20. So, in conclusion, despite the underpowered study due to the COVID-19 pandemic, we were able to show that this group-based physical exercise supervised program was able to sort of buffer the observed decline in the global health status domain of quality of life that was observed during the control phase. And so I think we can say that the implementation of group exercise-based programs might be an option in this population. And as a side note, this trial opened the door to keep the partnership with the hospital and with the local gym. And that's why the OncoMove program keeps offering a similar community program to breast cancer survivors. And so far, we've included more than 150 patients in this community program. Well, about the biomarkers, of course, larger studies may elucidate implications on metabolic responses to physical exercise.